New York State reported 438 more deaths from coronavirus in the past day, and that brings the death toll across the state to 15,740. Governor Cuomo today released preliminary results of statewide antibody testing. 3,000 samples were collected over 2 days in grocery stores and big box stores. About 14% tested positive for having the antibodies. Now, these are people who are infected and have now recovered. The highest percentages of positive tests, they were in New York City and on Long Island. Upstate had less than 4% test positive. The governor says this data will help him decide when we can start to restart the economy.
Governor Cuomo says some hospitals across the state can resume elective surgeries next week. The list does not include hospitals in Albany County and Rensselaer County. But Saratoga Hospital meets the state's criteria to begin operating again. Jackie Slater continues our team coverage.
Here at Saratoga Hospital, they have about 3,000 employees. When the shutdown happened, some of them were reassigned. About 200 were furloughed. By restarting these elective surgeries, some of them can come back to work right away. The hope is to have everyone back in May. No visitors allowed, and per the governor's order, no elective procedures since March. At Saratoga Hospital, Chief Medical Officer Dr. Richard Falavina says business as usual has been anything but.
We average about 12,000 surgical procedures a year, plus another 4,000 endoscopy procedures. But in the last month, we've only been doing about 40% of that volume.
Throw in the fact that overall emergency room visits are down, revenues have taken a big hit. Another negative side effect to all of this, Dr. Falavina says many patients that do come to the hospital are waiting too long, requiring extensive measures to be treated.
So really, in addition to that pandemic of COVID, we've seen a pandemic of avoidable complications from people who are not coming to the hospital soon enough.
But this week, some good news. Elective surgeries and procedures can resume under specific guidelines. As of today, Saratoga Hospital has had under 10 COVID admissions in the last 10 days, and they have more than 25% of their beds available. Starting next week, they're scheduling up to 50% of their normal elective procedures, a step in the right direction, but not the end of the road.
We do have to be prepared for perhaps a second wave. So turning on elective surgery is something we're going to continue to reevaluate every day, every week to make sure that we're doing it safely.
Reporting in Saratoga Springs, Jackie Slater, News Channel 13.